the second module of promoting physical activity, we will look at the burden of non-communicable diseases and their risk factors in Sri Lanka briefly. At the end of this session, you will be able to describe the burden of non-communicable diseases in Sri Lanka and to discuss the burden of physical inactivity in Sri Lanka. Non-communicable diseases are the highest ranking cause of death in Sri Lanka. The main non-communicable diseases which contributes to this burden are cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. Among the non-communicable diseases, ischemic heart disease is the leading cause of hospital deaths in Sri Lanka. In Sri Lanka, 1 in every 14 persons is suffering from diabetes with a higher risk among females. Considering the burden of hypertension in Sri Lanka, it's 1 in every 4 persons with a greater risk among females. Also, 1 in every 3 persons in Sri Lanka is either overweight or obese with a higher risk among females. When you consider the burden of hyperlipidemia in Sri Lanka, 1 in every 4 persons is suffering from this disease, again with a greater risk among females. There are 4 risk factors for non-communicable diseases. They are tobacco use, physical inactivity, unhealthy diet, and harmful use of alcohol. According to the STEP survey in Sri Lanka, 1 in every 3 persons do not engage in recommended level of physical activity. That is, at least 150 minutes of aerobic activities in moderate intensity per week. Also, it has been found more females are inactive compared to males. According to the National School Health Survey in Sri Lanka, 1 in every 5 children do not engage in the recommended level of physical activity for children. Also, it was found that girls are more physically inactive.